Hi, I'm Zach from Core Excel. Today we're going to show you a core exercise that we use in order to heal low back injuries. It's important to understand that low back injuries, when you're trying to heal them, it's not just about strengthening the core. That's only one component. You also have to strengthen the hips. And in the prior episode, we talked extensively on how to heal the hips, so we have a link at the end of the video on that so you can check that out. Before we go into the exercise, we're going to show you a testimonial from one of our athletes that we fixed with low back pain.
My back's been hurting me about 2 or 3 years now.
We just got done with 8 sessions, and are you 100%?
Yeah, definitely.
So there's no pain when you're running, when you're jumping?
No.
And you're a pole vaulter?
Yeah.
Real quick, next week, we're going to show you the progression exercise that we use, that we combine with this exercise in order to fully heal low back pain along with training the hips. And keep in mind that these exercises that we're showing you are part of Corrects 12. 12 exercises that fix your entire body. 5 for the hips, 4 for the shoulder, and 3 for the core. And the link to the Corrects 12 app is in the details of this video. This exercise here, what we're doing is we're targeting the side portion here of the internal and external oblique, where it attaches into the low back and then into the side of the rib cage here. This exercise here, we're getting the external oblique here, this side portion here over the ribs and right into the low back here. And that's what's so valuable about it, is that we can really build a better support structure for the lower back here by training this side portion. And if we hide this, we're also getting this whole internal oblique here, which ties in even deeper into the lower back fibers. If we hide the lower back muscles, look at how far that internal oblique wraps around into the lower back. So that's what we're building, is that whole support structure for the lower back and also for the entire core structure. If we look at the internal and external oblique, they're going to laterally flex on the same side with each other here, okay? But they're also going to depress when you're in flexion here, spinal flexion. They're going to depress the rib cage down. So that's why with this exercise here, that's how we're isolating it, because we're basically combining lateral flexion at the same time we're combining trunk flexion.
So before you guys move on to this exercise, we want to show you how to move your hips properly so that you can get all you want out of your abs. So what you want to be doing is you want to make sure that you tuck your hips and put your hips into a posterior pelvic tilt like that, and then relax back and then tilt. So notice when I roll my hips forward here, my abs are engaged. You can't slip anything underneath my back here, so it's flat.
So in that other clip, that tuck is going to become very important to the exercise, okay? So what I want you to do is just lay on your side here. Make a clam shape here, just like that, okay? And this arm just out here like this, okay? Now, if we're looking at it from this angle here, okay, put your chest totally perpendicular. Then just come back just a little bit, okay? And then make a fist with your hand here and pretend like you're reaching up to the sky here. And you're going to take your head and you're going to put it straight down the barrel of the gun right here. And then all you're going to do is just raise up, just like that. Just raise up. And look here, my shoulder here, okay? I should just be able to get my fingers here underneath here. Okay, you don't want to raise up like this. You're just using your obliques to lift up and crunch. See how short that is? Look, I can just get my fingers underneath. Look right down the barrel of the gun. This hand is going straight up this line right here, okay? And I'm not going like this. I'm not rolling out this way. Keep that side just like that. Now, if we look at it from this angle here, I want you to notice that when I come up with this line here, look at this. It's tucking. Look at that tuck right there. I'm maintaining that tuck there. If I don't tuck and I just come up, it turns more into a QL exercise. Okay, that's why you have to get that tuck as you come up. See, I'm here, and then I'm raising. I'm not here, it's here. And then I'm looking down that hand just like that. That's simple of an exercise, and if you're doing it right, you're gonna feel it all down this line of this rib cage, right in through here. If you're doing it wrong, it's gonna start creeping in the QL. That means you're not tucking the hips under enough. So if you're right-handed every time you swing, you're going into the same crunch position as this exercise. So you're basically developing similar muscle groups to that side. Generally, if you're right-handed, you're swinging on this side, you're going to be a lot weaker on the left side. So just keep that in mind when you're doing this exercise. You might want to do a lot more reps and sets on the one side versus the other if you feel that weakness. So the problem with doing just general side raises that you see, a lot of trainers and therapists do, different ones where you're just focused on lateral flexion is, that's going to tie, yes, it's going to involve the internal external oblique, but it's going to involve a lot more of the erectors and also the QL, and it's going to take away from really developing that side portion of the internal and external oblique. A lot of trainers, they'll do, wood chop exercises, or they'll take a band and they'll move this way, or they'll go side to side with balls. The problem is if you don't have the right core base, if you don't have the right lower abs and the right side of the obliques here, like we just talked about, then what happens is a lot of the time your lats, your QL, your erectors, and other muscle groups within that rotational chain will start taking over and dominating. So that's why we always use this side raise exercise to get into the obliques. And then once that's developed, that's when we start doing different exercises like this or like this. But you have to have the right foundation in order to isolate the obliques and really get into those muscles and get in deep.